thanks for joining us again with another live from the Nexus team. I am Tara. I'm the lead Nexus provider for Telemedica. And all month, we've been talking every week, focusing on support documents for VA disability claims. To let people get logged in here, I'm going to just quickly review our past topics this month. So we covered DBQs, Nexus letters, rebuttal letters, the importance of a good chart review. And if you've missed any of those and would like to review those you can catch the replay for those. It has a lot of helpful information if you're not sure about any of those types of documents, if they're right for you, or it may have some helpful information if you already know about them, but there may be some things in there that you might not have known. So today we're going to be talking about doctor's visits. Specifically, I want to talk about some key facts on how they can help your claim and how they can hurt your claim, and things to look out for, and some key tips for ways that you can help ensure that your records are accurate and reflective of something supportive for your claim. We'll also be speaking towards the end of the broadcast about how this applies to those of you who are already service connected for conditions, because yes, having doctor's visits is important to continue to have your service connected conditions remain connected. I'll talk a little bit more about that towards the end, but most of you that I've spoken to or communicated with were brought up and trained on a suck it up or not complain for other various reasons. And what we found is that it's been very difficult for some of you who have served years ago, say 80s, 90s, even more recently, to get those support documentation for your claims because you didn't run to medical while you're in service, or you thought that the condition would get better, or you were just young and weren't that bothered by it at first, but it became a much bigger issue as you got older. All of these reasons are why we talk about support documents this month and how to support your claim. And so focusing on some key concepts with doctor's visits can be helpful for those of you who are filing your claims. So some people who are in that situation, what you're ending up with if you don't have those doctor's visits are gathering unconventional evidence, such as receipts, pictures, anything that can strengthen your lay statement that events occurred and the timeline is the way that you say it is. And when, if you did go to the doctor, how could you be sure that that's helped your claim or not? So we're going to talk about some key factors to look for if you did go to the doctor as to what you can do to ensure that your records are accurate and supportive of your claim. And so we'll start out with some factors that to ensure your doctor's visits help your claim. So of course, number one reason, going to the doctor regularly will help your claim, period. Just, you got to suck up that pride and you just got to go. Even if it's yearly visits, or when, just to see your primary care doctor, have these things documented. The importance is documentation of your symptoms. If it's not controlled, it needs to be documented. And you may need to seek more frequent visits if necessary. It all helps your claim. So number one, go to the doctor. I know that's kind of common sense, but some people need to be told that a few times. I know I'm one of those people, because let me tell you, even as a provider, even if I wasn't, I was raised to just take care of it yourself. If you could still walk on your leg, it's not broken, and all of those things. And let me tell you, it just does not help if your claims if you don't go get seen. Other things they're talked about symptoms. Having accurate documentation of your symptoms so that they reflect what your current condition is, what you're experiencing. There may be times that you see your doctor and you have a very long conversation, but when they go to document that note, if it's not done right in front of you, there could be things that they forgot. And it's not that it's important for the treatment of your condition. It may be important in the service connection piece. So getting your doctor's records, requesting them, reviewing them, looking to make sure that they're documenting all of your symptoms and that it's accurate can be important. The severity as well, documenting the severity of your condition. If you failed any treatments, that should be listed in a record somewhere. May not need to be in every single time you see your doctor, but at least you should have somewhat of a regularity of having it documented what you were experiencing, what your previous symptoms were, what your current symptoms are, and if you failed any treatments or if anything has changed, because that kind of thorough documentation is what's going to help you, especially if you're filing a claim for aggravation. Because one key point with aggravation is that you need to show that turning point. You need to be able to show clearly, is obviously clearly in the records are the best method to go with, that this point your condition was stable or it was at a certain level, and then here at this point it's not. And the easiest way to do that is to ensure that your doctor's visits, the notes are actually reflective of that. Asking to be referred to a specialist for evaluation. If you're not getting better and you're seeing your doctor and we've tried several options and you're just not getting any better, or it's just not, the treatments aren't as successful as they should be, don't hesitate to ask to be seen by a specialist. See if you can get a specialty referral, because sometimes those specialists might be able to make an adjustment to your regimen just enough to actually improve the condition. And this can be for almost any condition. I mean, we experienced this with my son. He has asthma. He's very young. He's outside of the average age of what asthma usually presents. And so it was not on anybody's radar, even mine, that he had asthma. And I worked in emergency medicine. I've seen plenty of kids in respiratory distress. And I know it's different when it's your kid, but even his doctors, his regular doctors, the ER doctors, me, my husband, nobody was thinking that this was asthma or how to control it correctly. Even his primary care, all our first efforts were just not as successful as they should have been. And it wasn't until we got to see a specialist that we really got him controlled and on a regimen. It was a little tiny little thing, a little tweaking, and he was great. So that's kind of the best example that I have for the benefits of seeing a specialist. They see that particular condition hundreds and thousands of times. Whereas generalist, we pretty much see these conditions once in a while. If you're looking at that, it may be a regular situation like heartburn, high blood pressure that you see regularly, but to have a specialist who's very experienced in additional or advanced treatments, or after things fail, that's important. So I encourage you that if you're not getting the treatment or the results that you're looking for, don't hesitate to see a specialist. It will also add to your support to your claim. You're ruling out other causes for your symptoms. You're solidifying your diagnosis as the right diagnosis. You're showing that you have treatment failure, that the condition is very severe. So there's lots of reasons why that's helpful. You can ask if there are any other specialized testing or procedures related to the condition. I know some people with acid reflux, they may get some basic blood work, but you can always test for H. pylori. It's a bacteria that can be treated. So there are sometimes other testing that can be done to see what's going on, such as fatigue. If you're running if you're kind of running into a lot of fatigue and your doctor's evaluating it, there are some specialty tests that they can do, checking not just your basic blood work, your thyroid. You can also test for other things. And so just trying to sift through what's causing the symptoms, or did you evaluate the condition completely, can help your claim as well. Like I was talking a little bit before about reviewing your medical documentation, that's very important. It's your right to request your medical documents. I encourage you to do that on a regular basis. So especially if you're filing claims, or even if you may file something in the future. So requesting your documentation and ensuring that all of your symptoms, all the facts are there correctly is important. It's not unheard of that if something is listed incorrectly, that you submit for the doctor to correct that. Now, if you're requesting that they change their medical opinion, that's completely different. That's not going to happen. But if there is an error to where you have nausea and vomiting with the condition and that wasn't listed and you'd like that added to it, that's a reasonable request. And it just might have been omitted, not for any specific reason other than by accident. So making sure that that's correct is important. But you can also review other providers' notes. If you go to physical therapy, chiropractor, acupuncture, you can get the copy of their records so that you have a really accurate picture of your condition. And submitting all of those documents can be very helpful to the VA, and having that organized. So think about that. One area that usually does not have medical records are massage therapy. But that can, like medical massage, can be an important part of your treatment plan. That being said, you can request a copy of your visits. You can get a list of your visits, showing how often you have to be there. And if you see the same therapist over and over again, you might be able to even ask them for a short statement on what they're seeing you for and the status, if if you're getting any relief from their treatments, or if they're constantly seeing you for your low back, that could be helpful to submit to for your claim as well. Let's see. Obtaining old records. This is one that I hear a lot of. So I hear a lot of people who've moved, who don't see the same doctor all the time, who might have been in an urgent care here and a doctor's office there in a different state or wherever. And it's important to get those records because it shows a timeline. So if you left service in 1992 and your current diagnosis and your current doctor you've been seeing since 2010, there's that gap. That gap in care is a huge reason why we see a lot of denials. And to close that gap the best that you can say, I saw doctors, I was at urgent care, I was here, I was there. But without that proof, it's hard to really rely on that as fact. So getting these documents after your visit or keeping a record of it, even if it is the receipt, the follow-up study. I know certain programs such as a medical record program such as Epic have an after visit summary. And most of the time you get those handouts from your doctor. That's anything, get any proof that you have been seen will actually help close that gap. So it is worth your time to make those phone calls. One thing to remember is it is pretty common for doctors' offices and treatment facilities to only keep their records for an average of 5 to 10 years. So if it's more than 10 years, you may be out of luck. The only thing you can maybe do in that situation, don't give up. Think creatively. If that doctor is still practicing, they may remember you and be able to attest to, yes, you were their patient, and they may remember the condition they were treating you for. Getting that on a memo from the office may be sufficient to show that you had treatment during a specific time frame. You can also get a letter from the clinic that you're right, you were a patient there, but your records were destroyed after a certain time period. Any little bits and pieces of it may be what's needed to close that gap. So anything can help. And I really encourage you to put forth that effort and really call those facilities and see if you can try to get your records if possible. An example that I'd like to talk about, and I've talked about this more than once, I'm sure, on a video, because it is a sticking point in my mind. It's something I'm really passionate about. An example I use for ensuring your documentation is correct, I like to use GERD. So many people have a diagnosis of GERD. It is so common. And I remember when I was going through medical training, we really didn't focus a lot on specifics other than symptomology and different conditions similar to GERD. From what I remember, there was really never a focus on veterans or other reasons that you would diagnose them with things such as heartburn. It was all focused on trying to get a specific diagnosis. And that's really good, but it's not good for veterans, specifically of the Gulf War era. And I don't think training programs have really changed. And that really bothers me with this because it is such an important, tiny detail. So GERD itself does not qualify for presumptive service connection for Gulf War syndrome because it is a structural condition. You go in to see a gastroenterologist, they do a scope and they take a physical look at your throat, your stomach. They see evidence of irritation, erosions, redness, inflammation, ulcers sometimes. All of that means that you have a structural condition, GERD, something different like an ulcer. But that supports a GERD diagnosis. If you go and you have blood work that's normal, you have a scope that's normal, and you still have severe symptoms, that lines more closely to a functional condition, which is covered under the presumptive conditions for Gulf War. So if you've never seen a gastroenterologist, how do they know? And you got a diagnosis for GERD. That is the issue that I have when treating veterans. And I don't think the providers are intentionally trying to do anything to harm you. I think that they just don't know. That's the thing. There's just a gap in their knowledge about veterans, and specifically Gulf War veterans, who have these symptoms that are functional, not structural. Whereas in the general population, you're not seeing this. So to diagnose someone in the general population with a functional gastrointestinal disorder like functional heartburn or dyspepsia or just the symptom of acid reflux instead of an actual concrete diagnosis is rare, but it's very common in the veteran population post Gulf War. because it is this increase in functional conditions that we've recognized. And so you may have been misdiagnosed, not on purpose, but just by chance, because it's not something you see in the civilian world. So asking that question of your doctor of, is this the right diagnosis for me, can be a conversation that may be helpful to you in your claim. Because if you've never seen a gastroenterologist, you've never had workup, you've never had testing, GERD may not be the right diagnosis for you, especially if you're looking at a potential Gulf War connection. So asking those important questions and getting that documentation to review is very important, because that can make or break your claim. So I said a lot there, and I just want to make sure that we're on the same page. Functional conditions, so Gulf War connections, just in general. I'm going to go on a sidebar here for a quick second. Gulf War connections are unexplained illnesses, multi-system illnesses that we just don't know why they're happening to you. We don't know why you're having the symptoms. That's the type of thing. They're unexplained. That's the biggest way I can describe it. Unexplained illnesses. Whereas GERD, migraine, they all have a specific etiology or cause. And so if you get those diagnoses by mistake, you're not going to be able to claim them to Gulf War. And it is not going to be a presumptive. And so if you're not sure and you think you've been misdiagnosed, that you haven't had enough testing to get that structural condition diagnosed, and you think you have a more of a Gulf War functional condition, or you have the symptoms without any evidence of something physical there, have that conversation with your doctor, ask them to send you to a specialist, ask about functional conditions, and talk to them about Gulf War, and talk to them about how this is something more prevalent in that population. And you should be able to get set on the right path. And if it's something that needs a change in a diagnosis happens, you can have your doctor document that you were originally diagnosed with GERD. This was not correct. You have a functional gastrointestinal condition, and that you can submit to the VA, and you should be able to get that presumptive service connection if it applies to you. It doesn't apply to everybody. I'm sure there's Gulf War veterans who have structural conditions like GERD. It's just one of those sticking points that I feel that some veterans are falling through the cracks, and it's just not being taught in medical schools and teaching programs who don't regularly deal with veterans. Okay, let me get back on track and talk a little bit how medical records and seeing doctors can hurt your claim. So just like the number one reason it'll help, the number one reason it'll hurt is not going to the doctor. Same thing. If you don't go to the doctor, it's not going to help. If you don't follow up as instructed, or you get seen, you get a diagnosis, and then nothing, then it kind of is assumed that you don't have the condition anymore, that it resolved, or it's not as big of a problem as what you're saying it is. We see that a lot with veterans who get seen in service for, say, an orthopedic issue like your back, your knee condition, or something like that. You get seen once in service and not again for 20 years. And now you have arthritis. And so the diagnosis in service is back strain, and the diagnosis 20 years later is arthritis. It is hard to make that connection, because yes, it may have been progressively worsened and caused by service, but without that documentation, without you having that doctor's visit in between, it makes it very hard to prove, because we have to show that you don't have another condition after service that could have caused your current condition. So you have 20 years of things that happen to you that you have to rule out as not the cause if you don't have those doctor's visits. So it can make a very difficult case. And it's something that we here at Telemedica, we deal with all the time. We see very regularly. So it is one of those on the top of my list for how medical records can hurt your claim. If you've got one record showing one visit and then you never get the follow-up, you never get that chronic diagnosis. Remember, the VA considers the condition that has been present for at least 6 months as chronic. So if you get that one visit, you really aren't even showing that the condition is chronic, let alone progressive to a more severe form that you currently have. So there's a couple of key things that we need to prove when it comes to service connection for direct for orthopedic conditions. If your diagnosis is incorrect, that can hurt your claim. Like we talked about with GERD. If you have an incorrect diagnosis, then there may be some things that make it difficult for service connection. If you don't have your symptoms or treatment efforts documented correctly, so getting that doctor's note and reviewing it to make sure that everything is listed correctly. And we're not talking about their medical opinion. We're not talking about their interpretation of testing. We're talking about what you report to them, the symptoms, the severity, the limitations, all of that stuff can be clearly documented by them. So you have to consider, the reason I'm saying that is because some conditions are rated by the VA by their symptoms. Some conditions are rated by the VA by range of motion testing. Some things are rated by a subjective scale of severity, mild, moderate, or severe. If you don't have documentation of the severity in that way, then you're leaving that up to the VA rater and the C&P examiner to determine what their view of mild, moderate, and severe are, which could mean a huge difference in the service connection percentage that you're getting. So you can always double check that by looking up the 38 CFR, which is the Code of Federal Regulations. That has a list of all of the percentages and requirements as to what condition meets what percentage. And so if you're looking in the 38 CFR for acid reflux or GERD, for instance, it's under hiatal hernia. They combine hiatal hernia with GERD. That's just how they do it with some conditions. And the 10% range is 10% rating is based on symptoms. The 30% is based on symptoms plus the condition has to be productive of considerable impairment of health. That is a 30, and that is a very subjective thing. What is impairment of health? And so I look at that as the better you have your documentation from your doctor as the limitations and restrictions go, the more likely chance that you're going to be able to check that box of producing considerable impairment of health. And so that can mean the difference in that particular condition. And there are several others. IBS is rated that way. It's rated as mild, moderate, or severe. It's very subjective. So having your doctor comment on what they think your condition is, or even just documenting the symptoms, even if they don't put mild, moderate, or severe that word in, having your symptoms documented, having failed treatments, hospitalizations, all of that documentation lends to coming up to a conclusion of how severe the condition is. So the more documentation, the better. So same thing, like I talked about secondary effects. So if you don't have secondary effects in there, such as how the condition prevents you from functioning at home or work, if you don't talk about how that condition interferes with your life, then it may prevent further workup from your doctor, or it may be relying on your personal statement only instead of having some hard evidence that you've been complaining that you can't perform these tasks at home. One big item that's important for is if you're trying to file for aid in attendance. Aid in attendance, we're going to be talking about that next month and posting some things about that next month. It's where you need someone, family member, someone to help care for you, perform some activities of daily living for you, such as dressing, showering, meals, transportation, things like that. If you don't have any documentation other than your word, that's not going to be sufficient for the VA to grant that. You really need a functional assessment on top of that as well. So your doctor can do that. An occupational therapist can do that. But if you're documenting that you can't dress yourself and you've had that documented for years in your record, that could help you filing that aid in attendance claim. If you need someone to, like I said, help you with the shower because your back flares are so terrible, having some of that documented in your records may help you to gain those additional benefits if that applies to you. Other more interesting things that can hurt your case, it's not about, you think about omissions. That's what we've been talking about, omissions in the record. But inclusions can also hurt your case. Things that are in your record that are included there can hurt your case. For instance, I've reviewed, I can't even tell you how many cases like this. And if you're filing a claim for your back condition or your knee condition or whatever, but all of your medical records talk about how you love to go camping and climb mountains and you go on these very long and challenging hikes and spend several days out in the bush somewhere, it's really hard to support your claim that your knee condition or your back condition is so disabling that it requires service connection, because those statements tell me as a medical provider in reviewing your chart that you don't have any functional limitations, that you're in good health, and you're functioning far beyond the average American. I'm not telling you to omit this information from your doctor. I'm just telling you that accurate documentation is reflective of your current status. And if, say, for instance, the same person had looked at their record, but it's inaccurate. Yes, you like to go hiking. Yes, you like to be out in nature, but those hikes are in paved path with 0% incline, many benches to rest at, and it takes you 4 hours to do 1 mile because these are your attempts at losing weight and maintaining an exercise level. That documentation, having that documented accurately is going to be very helpful. So that paints two very different pictures to me as a provider or someone reviewing your chart as to what that means. So if you just say, I like to go on long hikes or I like to go on long walks or whatever, you can interpret that very differently. So having some context as to the specific situations where that is can be important, and having it documented that you're attempting exercise and dietary changes is very important when we're trying to connect things secondarily, using something like obesity as an intermediate step, that you're saying a service connected condition caused you to become obese or prevented you from losing weight, and it caused the second condition. And we're trying to use that bridge to connect it. Having that documented in your record about your exercise efforts are very helpful, but having it documented accurately is important as well. And so keep in mind the way you have things documented can make a difference, and to have it reflect correctly. Lastly, I want to talk about situations related to your service connected conditions. Yes, you who have service connected conditions can have positive and negative effects with medical documentation. And I want to talk a little bit about that real quick. So I frequently see veterans who end up getting their claims service connected. Woohoo, get high five. We get, 100%, something happens, but they're not permanent and total. They're not P&T. And then they stop getting seen. They stop seeing their doctor. They stop going for follow-up. They stop taking medication, or they just disappear. It's like all of your records just abruptly end. And then you're not permanent and total. What happens is that you are on a schedule for reevaluation. The VA has a regular schedule of reevaluation of your service-connected conditions to assess their level. Are they the same? Are they better? Are they worse? For all conditions that are not permanent and total, or not under permanent and total status. So periodically, I don't know the timeline for that, but they have it set up for every specific condition, the timeline. So they know that in 3 years, 5 months, they're going to see you for this condition, and it is already ready to pull the trigger. So when that time comes up, you'll either get a notice of C&P examination or just notice that it's being reevaluated. And I can't tell you how many times I see veterans just stuck with that. We're proposing to reduce your award, and you go from 100% to 90%, which cuts your award in half, essentially. That's a huge hit on you financially. And you're struggling and you're clamoring, going, okay, now trying to gather information, but you haven't been seen in years. So that can hurt very, very badly. So if you get service connected and it's not under P&T status, which we'll be talking about next month as well, it's important to keep those doctor's appointments. Get seen at least yearly by your doctor. Keep those conditions current, keep the symptoms current, make sure it's all accurately and currently documented so that you don't run that risk. It's not something that you should be fearful of. It's just a helpful tip and reminder to continue with that follow-up care. It's going to help you become more healthy. It's going to help you take care of your condition more accurately. And it's going to ensure that your rating either remains the same or increased if your condition worsens. You have that documentation and evidence. We see it all too often that clients will come to Telemedica and ask for an increase in their, we talked about GERD, let's talk about GERD, increase in their GERD condition. And like I was telling you, the 10% rating is based on symptoms, 30% is based on impairment of health. And how we cannot attest to the impairment of health and that condition has worsened from your 10% of symptoms only to that 30% if we don't have current treatment records, if we don't have evidence to say you failed these treatments. You go to the doctor, you take your medication, you follow their instructions and try to lose weight, try to eat healthy, but it's not working and you're not getting any better. It's one of those things that it's really hard to make that jump if you don't get seen. So it can hurt. This situation can hurt you if you currently service connected for those conditions. It may not happen today and it may not happen tomorrow, but in a few years, you might be in that spot. So we'll see if we have any questions coming up, but I'm going to so you can go ahead. If you have any questions, please type them in. We'll see what we have. But to summarize what we talked about today are how medical visits can help your claim or hurt your claim, depending on what's being documented. So maintain current service, maintain current records, make sure they're accurate, make sure they're reflective of all the symptoms, and don't hesitate to speak up to your doctor if you think something is incorrect or if you think that you should have additional testing. It can be important. So let's see if we have any questions here. Okay. So the first thing, how do I get started with Telemedica? You can reach out to us, either our customer service team by phone or through our website, and sign up for Nexus services for medical conditions. There is a separate mental health team. So if we're talking about any mental health conditions, that is a separate team, and they will likely be the ones taking care of your needs there. But that is the way to get in touch with us. Like I said, we can help with initial connections, increases. There are certain things we can't do increases for, increased DBQs for orthopedic conditions, some heart conditions, some neurological conditions. There's some specific ones. We do have a list on our website of things that common conditions that we can do a DBQ for, and increases would be a DBQ only, which is why I speak to that. But if you're not sure, signing up and having one of our medical providers take a look at your chart, take a look at your case, and see which document might be most helpful for your claim is definitely something that you can do. Let's see. I want to know, off topic, but if Tom had asked a question, but if a veteran is treated by multiple medical professionals, primary care, sleep specialists, Telemedica, have we found it better to obtain multiple DBQs or Nexus letters to help? It doesn't necessarily, more in that sense with Nexus letters and DBQs, more may not be better. It just depends on the situation. So you mentioned primary care and a specialist, like a sleep specialist. So all medical providers are treated the same. So for instance, a PA or a nurse practitioner is treated the same as a doctor. The only difference that might be weighted differently might be if it's a specialist. So you mentioned a sleep specialist, but I've seen cases where you get a Nexus letter from a sleep specialist and it still can get denied. So it's not foolproof if you go for a specialist letter only. You really don't necessarily need more than one, I would say initially at first, because you don't know if they're denying you. You don't know the reason they're denying you. And so if you start your case, never filed it before, and you go out seeking 5 Nexus letters, that might take you a long time, depending on who you're asking them from. It may cost you a large amount of money, which is unnecessary. If you're able to get your treating doctors to write something and submit it and they're familiar with the VA language and they submit the document with a good rationale, that may not cost you anything. A lot of doctors are not familiar with VA language or providing an accurate rationale to provide a positive opinion. So sometimes people will have things written by their doctor and by some private companies such as Telemedica, who specialize in that kind of wording and language to be able to support the connection in addition to your doctor's note. So sometimes yes, and sometimes you're not sure. If we have a denial letter that we're able to review and know the reason for the denial, that is the most helpful. So blindly just submitting multiple documents is not as helpful. If it's your first claim, hit and miss. That's my answer to that. It's hit and miss. Yeah, you can have additional, if you have people willing to write you documents, absolutely submit the most amount of documents possible. But if you've been denied, actually looking at that denial letter for the reason that it's denied can be more helpful than having multiple positive opinions. Because if they denied you for a reason that was, for instance, they need more medical records between 1990 and 1995, you can have as many documents as you want. And no Nexus letter is going to help you. They actually are asking for documents between those years. So unless you're getting a letter from a doctor who treated you during those years, you're not going to get that denial overturned with a regular filing. Maybe with the VA Board of Appeals, you might have more success with that, but it's not really there's not really cut and dry. There is no real black and white method to follow with some of this. And so it's a hard question to answer. And the best way I can say is if you've got people willing to write, by all means, but I wouldn't spend a fortune getting multiple different companies, multiple different letters until you know the reason that you get denied. I don't think it's hurtful to submit some evidence, plus or minus the nexus and DBQ, find out the reason if they do deny you, and try to go from there, because it'll give us a lot of insight. At least, we find denial letters give us a lot of insight. So it's really how you feel about the filing and the support evidence that you have. Because if you have a lot of really good support evidence, you may not need a lot of letters or DBQs to do that. So sorry for the long-winded answer, but I wanted to be thorough with that. So another one had asked, I want to know something. When a baby is 3 months in her mother's stomach, his or her heartbeat, please say. I'm not sure I understand that question. I think the question is asking if at 3 months, if the baby's heart is beating or not. Baby's heartbeats can be detected at as early as 5 weeks, I believe. I'm not an OBGYN specialist, so that specific timeline, I'm not 100% sure exactly when, but I do believe most people they miss their cycle around 4 weeks. And so if you miss your cycle, a lot of times people will get that ultrasound. And so you're looking at roughly 5-6 weeks. So I'm not sure if that answered that question or not, but off topic, and I'm here to answer whatever questions I can. So if anybody has any others, otherwise, it looks like that was the questions. I think I was pretty thorough with trying to give some good examples to help out. So with that, I will thank all of you for joining us, and we'll see you next month. We're going to be posting about specialty documents, P&T status, TDIU, DIC claims, aid and attendance claims. We're going to be doing a mix between some postings, as well as I'm going to be doing a live sometime next month. I don't think the date has been set exactly, but we will definitely announce that. And I think if you subscribe to announcements, that it gets sent out to our email list when we're going to be doing these. So I'm going to do next month, going to be talking about comparing, contrasting P&T and TDIU claims, because I think that's where there's a big sticking point with a lot of people. They get confused as to filing for those two different types of statuses, what may be helpful to them. So we're going to get into a little bit of details between P&T and TDIU, but throughout the month, we're going to be posting about all those types of specialty documents. So hope to see you then. Have a great day.